Hey guys, and welcome to another episode of the Barenaked Health Podcast. I'm your host, Nick Kruse, and today I have the pleasure of having on Dr. Jack Kruse. Dr. Kruse, welcome to the show.
Thank you. Happy to be here.
Thank you, thank you. So we were just kind of starting before we got on here. We were talking a little bit. I was giving him a rundown, like, "Hey, I'm a manual therapist. I'm a physical therapist, doing a lot of that." And I was asking Dr. Kruse about, all right, how does all of that tie together with the light, the water, the magnetism? I know he's been talking about chewing a lot of mastic gum for the sphenoid, which for people that don't know is like uh, I look at it as the keystone of kind of the cranium of just holding a lot of things together. Dr. Cruz, if you want to kind of even just take it from there a little bit, please.
Yeah, well, I mean, it's probably a bigger framework for people who are interested in the basic biophysics. You have to remember in any axis, mathematically, you have to have an X, a Y, and a Z axis. And in our body, the body plan of humans, the X axis is the sphenoid bone. The Y axis is the remnants in the notochord, which in us is the occipital bone, the clivus, and then the vagus nerve. Um, Technically also the spine, but the Z axis is the heart. So these three axes are what the GPS system in us pays attention to. What's the GPS system in us? It's the human thalamus. It's where all the sensory integration in the human brain comes in. And the thalamus is surrounded by the neurons that surround the ventricular system. And it turns out the ventricular system, where CSF is made from blood, is the thing that connects to Schumann resonance. For those people who don't know what the Schumann resonance is, that's when the sun sends out plasma, hits our magnetosphere, creates electricity, and creates a standing wave between the ionosphere and the surface of the planet at 7.83 hertz. How do we know this is true? For those people who are listening to this and don't know that this science is well developed, the alpha wave in an EEG is 7.83 hertz. So every single animal on this planet who you do an EEG on has an alpha wave in that area. So we now know that the alpha wave comes from the thalamus as well. So what we basically just said very, very quickly is that we're impedance matched to our sun and the earth, also to the moon, through this mechanism in the GPS in the head. And everything that's tied to circadian biology pays attention to these mathematics. So when you understand the computer based in your head, how it tells where it is in space time, then you need to realize, okay, how does this system work? Okay, because how it works is pretty freaking amazing. But the key thing that you just brought up, the sphenoid bone goes from temple to temple. And as a neurosurgeon, and any neurosurgeons who watch this will tell you, the sphenoid, the greater wing, has a point called the pterion. The pterion is where if you get a fracture, you can get an epidural hematoma. That's probably what it's most famous for, but it's not that famous for me for that. You also have the external carotid artery in this area, and that's really key. In the center of the sphenoid bone, you have the two carotid arteries, and then what gets penetrated by the sphenoid bone? The pituitary, the hypothalamus is horizontal, but here's the big one. Cranial nerve 5 and cranial nerve 2. So what does that mean? You get penetrated by the light from cranial nerve 2, and you get penetrated by the mechanical vibration of 5. Why? Because in the base of the sphenoid in Meckel's cave sits the trigeminal trigone. And what is that? That's where all three divisions of the fifth nerve, that's ophthalmic, maxillary, and mandibular, for your whole head and neck come in. Why is that important? Meckel's cave is one of the ways that we deliver the deuterium in our brain during sleep, called through glymphatic drainage to Meckel's cave. It also goes into the cavernous sinus, and then it's designed to go to the jugular foramen, which, as you know, as a physical therapist, sits lateral in the occipital bone. And we're designed to flush that whole system, every night through REM sleep, because REM sleep actually acts as pumps on the eyes to pump all this stuff to the cavernous sinus. And we're designed to get rid of this stuff so that in the morning, after we're out in the sun like I am right now, and you have breakfast, you make a nice Bristol 4. Okay, why? Because the kinetic isotope effect of deuterium is designed not to be in your head, it's designed to be in your poop. That's the reason why we always talk about Bristol fours. And it turns out this gastrocolic reflex that controls all this, believe it or not, is tied to this GPS system in the X, Y, and Z axis. So the X axis, which is the one you're interested in, bone is piezoelectric, which you know. It's also flexoelectric, it's pyroelectric. So why did evolution put the external and internal carotid associated with this bone? Why? Because it needs to get feedback from the Z-axis. Okay, that's the key. And the Z-axis is being the heart. Why is the heart the biggest deal? Because the heart and circulatory system contain most of the deuterium in the body. Like most people, when they hear deuterium, especially from what I would call influencers or PhD or what I like to call on Twitter is retards, they always think that deuterium is bad, and it's not. It turns out, believe it or not, the big ass breakfast that's part of the leptin prescription, the way I designed it, you want to eat within 30 minutes because you're designed to increase the isotopic load of your food so that the vortex is really good. Because you can't have a vortex if everything was just made out of H plus and not deuterium. So it turns out we have to have some deuterium, and it turns out the body does a really good job of trying to keep it within the circulatory system. But the key to the heart, understanding the heart and what the Z-axis is all about, this is where a lot of people lose, I guess I would say lose the plot of biophysics. Your heart is a helical muscle. It's not considered a skeletal muscle, but technically, way back in evolutionary times, and I'm talking Cambrian explosion, it was. And the first version of hearts that ever show up right at the Cambrian explosion are fish. They're one-chambered hearts. One-chambered hearts don't make a big vortex, but fish don't have a lot of things to deal with, so it's okay. Plus, they're swimming in a sea of electrons, so it's actually not as big a requirement. Then we got the next big group of animals that come in evolutionary times, which you've heard of, especially through all the things I've been teaching people about Robert O. Becker, is he did all these regeneration studies on amphibians and frogs and salamanders. Well, it turns out those guys have three-chambered hearts. And what's the difference between one and three chambers? The not only the size of the vortex, but here's the key thing: the complexity of the vortex. Now we come along, and when I say we, I'm talking about much more complex mammals. Mammals evolved 320 million years ago. All mammals have four-chamber hearts. So guess what? Four-chamber hearts make the most complex vortex. That's the reason why, for anybody listening to this, if you learn about HRV, they'll always tell you that people that are most healthy have the most chaotic vortexes. And what is the purpose of the vortex when the blood is delivered? This is the very counterintuitive part that the influencers always get wrong. Your arterial tree is designed to have elastin and fibrilin in it. Turns out the elastin and fibrilin is followed by neural crest cells. That's where POMC and melanin comes in. And that's how the brain, specifically the thalamus, is getting feedback on what's going on in the Z-axis. It also gets the feedback from the sphenoid bone. So it's almost like the Z-axis and the X-axis are talking together because the external and internal carotids are affecting the sphenoid. Now, obviously, cranial nerve 2 brings the light to the game. I think I've told this people, this goes back a really long time on my forum, 15 years ago, that cranial nerve 2 makes up, it synapses with almost 48% of the neurons in the telencephalon. When you actually think about that, you're like, fuck, our central nervous system design is kind of telling us that light is really fucking important. But, a lot of people, don't look at this from my perspective, the biophysics perspective. So predominantly from, I guess, 320 million years to us, because we're about 4 to 6 million in Homo, you see a massive amplification of the importance of light. Now, what do you have to realize that's going on in evolution this whole time? The magnetic sphere, meaning the dynamo on the planet, is extremely stable during this whole time. If you look back at the history of Earth, that's not the case at all. In fact, this is probably the most interesting part of the story for you to think about because it has huge implications for your job and it does for mine as well. Um, the last time we had a true magnetic flip on the planet was 780,000 years ago. Remember what I told you about the Cambrian explosion? It happened 540. So that means the eukaryotic domain has never experienced a true magnetic flip. But what have they actually been affected by? By an excursion. An excursion is when the field gets weak but doesn't flip. And for the people who are listening to this that want to know why I'm making this distinction, guys like Roger Cunningham, who's made famous something called ECDO theory of the magnetic flip. It's tied to a Russian effect related to mass that caused things to flip in the planet. And we first learned about it in the ISS when they spun a screw and they saw it flip magically with no energy put in, and everybody was like, why does this happen? Turns out when you lose magnetism or you lose some gravity, this is much more likely to happen. And then there's another cat who's a lawyer who plays I guess tries to play scientist on Twitter or on YouTube. He's a space guy. He talks about his issues as well, and this stuff is good, but like I said, they're both missing big parts of this story when it comes to us. And let's be quite frank, we're interested in us as biologists, and you're a clinician, I'm a clinician. We want to know how these basic biophysics things relate to our daily activities with our patients. And it turns out that magnetism, the big claim to fame with it, is mammals have always lived in a very stable zone. But here's the interesting thing. Remember, we come from, because we're eukaryotes, we come from an endosymbiosis of bacteria and archaea. So what does that mean? Well, bacteria and archaea have been around the planet for 3.8 billion years. That means they've experienced fucking flips like left and right. They've experienced excursions. So they turn out to be masters of that domain, okay? But eukaryotes aren't. So what I've been doing recently is teaching this biophysics, because I don't think anybody's teaching what I'm teaching now, especially the influencers, because they only focus on what I call the low-hanging fruit, which is circadian biology. This, by far, is probably most important because it's one of the foundational core pillars behind all the things that you're interested in to deal with your patients. Why? Because it turns out the number one protein in our body that you manipulate probably more than I even do is collagen. And collagen is only made up by 3 amino acids. But guess what? Those 3 amino acids only can work optimally when oxygen is in its ground state. Why is this important? What does ground state mean when I talk to you? It means that oxygen's in the triplet state. When it's in the triplet state, it's paramagnetic. Paramagnetism means it's drawn to magnetic fields. So in June of 25, a very interesting paper in Science Advances came out. I've been talking about it literally without long on my forum. It shows that for 540 million years since the Cambrian explosion, the dynamo of Earth is connected to oxygen. The paper makes the mistake of trying to link this to tectonic activity. And I'll tell you why it's a mistake. Because it's on first principle basis, you know that I'm right and they're wrong. My belief, this is tied to the thermohaline currents that the dynamo yokes to. Why? Because where did oxygen first form? In the great oxygenation event from cyanobacteria in the oceans. If we are to believe the paper that it's the tectonic plates, we've had probably longer part of our history, 3.5 billion years, where the planet was anoxic. So how could tectonic plates be linked to oxygen when the planet's already anoxic? It actually makes no sense if they would have thought about it. But when I saw the paper, I didn't, throw it in the garbage can and tell everybody, oh, this is bullshit. The paper is actually really important. It's probably one of the most important papers I think that's come out in the last 10, 15 years for the biophysics of life. Why? Because it tells us a very interesting story tied to your life and my life. It means that eukaryotes, specifically mammals, cannot tolerate any ability of magnetic insufflation. So when you have an excursion, say you don't have a flip, if you have an excursion, that means one of the first things that's going to change in the body is the two things that are you're most interested in: water and collagen. Why? Because when you have a magnetic excursion, what is the biophysics of it? Because it's very simple to understand. Think about this hand, the left hand, as the crust of the earth where we all live, okay? Where the oceans are. And this is the Van Allen radiation belt on the top of our atmosphere. When what below my hand gets weak, okay, this gets closer. And when it gets closer, it emits deuterium and tritium. Now, it doesn't do the tritium until it gets significantly weak, but it does deuterate things. What's the first thing it deuterates? It deuterates water. So the water tables of things get really toasted. What is the second thing that happens? You start to see effects on things that are tied to oxygen. Why? Because it turns out deuterium binds to oxygen. It has a 6 to 10-fold kinetic isotope effect. So what effectively does it do? It makes tissues hypoxic. So you could see a patient who's got, I don't know, say an Achilles problem or a problem at the cranial base, and you're manipulating them. If they're deuterated because they can't get rid of the deuterium, you can do all the manual therapy you want. It ain't going to work because you don't know that the kinetic isotope effect is lattice locking their water table. And it could be frustrating for you until you learn some of this stuff that we're talking about. Why? Because you could be really smart and say, I'm going to put a TENS unit on both sides of the pterion, or I'm going to put a transauricular vagal nerve stimulator, and I'm going to try to stimulate you with mechanical vibration to unlock your lattice. Why? That means that the dielectric constant of water goes from 78 to 160. What does that mean for everybody listening? It means the viscosity of water, the water table in you changes. So remember, everybody I think knows who's listening to this, because you're a biology guy, so I'm assuming your audience is not filled with people who don't understand the basics, but your ATPase spins at 9,000 revolutions per minute. Well, if you're spinning 9,000 revolutions per minute against maple syrup versus, say, water, who do you think wins? Well, you got the answer. And guess what? That's effectively what ligament laxity is when you look at it from, I don't know, 100,000-foot view. So what's the real goal in therapy that you weren't taught in your Rockefeller training and I wasn't taught in my Rockefeller training? That maybe, hey, maybe we should defrag the water table before we do manual therapy. That might be a good idea. So I've been doing that to people for about 20, 25 years, especially my professional athlete clients. And I don't think a lot of people really understood like some of the things I are doing, because there's a lot of different ways to do it. Believe it or not, an anesthesiologist does it every time I do surgery on somebody. Why? At the end of the case, when they're getting fluoridated inhalational anesthetics, the fluoride is a dielectric blocker. It knocks the 160 down to 78. That's the reason why you're unconscious. It turns off the thalamus. It won't let the ATPA spin. So what's the first thing that an anesthesiologist does to wake you up when you're under a general anesthetic? They give you 100% oxygen. Now you should understand why this works, because of what I told you about that paper, that a massive amount of triplet oxygen is capable of breaking the lattice. Let me tell you another issue that this ties to, because I'm sure there's going to be some anesthesiologists or even some patients that listens to this, and they're going to go, okay, so now I understand why my kid went crazy after anesthesia. That's called emergent delirium. And if a kid is lattice locked, one of the things that happens, they'll wake up and they're like nuts. The nurses in the recovery room will call the doctor and go, I think your patient's got a huge problem, da 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 da. The way we treat them, we usually treat them also with high levels of oxygen. We also do other things to get rid of it. Another thing that the anesthesiologist deals with before they get to the recovery room, and this one's probably the most interesting because I'm going to write a blog about it. I haven't released yet, but I'm going to share it with you because I think it's important because it ties to some of the things we talked about, which is laryngospasm. Like when you get ready to extubate somebody and the tube coming through the cords meaning the vocal cords, that little irritation can cause the cords to lattice lock, meaning they close. If you take a look at what I'm doing here, once that happens, once both the cords come together, that's like your laryngeal nerves, which are the vagus nerve branches, doesn't allow you to breathe. So if you can't breathe, we either have to put the tube back in and damage the vocal cords, or we have to do a trach or a cricothyroidotomy at that time. Now, in my career, I've only had to do a cric one time for this when we couldn't break the laryngospasm. What's the number one treatment for laryngospasm? It's 100% oxygen. And I added to my regimen 3% saline. That's something that I told my anesthesiologist that would help. And also, they squirt racemic epinephrine down the throat. That will actually do it. So, most people probably know when you have an allergic reaction, what do you give? You give an EpiPen. Well, this is the anesthesia version of an EpiPen. Okay. And generally, those two things that anesthesiologists do. The second case that I was involved with, where someone got laryngospasm, we literally had one of my assistants next to me getting ready to poke a hole to do a cricothyroidotomy, and we had a central lining because this was a brain case we were doing. And I told the OR nurse to give a bolus of 3% sodium chloride. Literally, I gave 250 cc's of fluid like that. And because I knew that it takes 13 seconds to go between the heart and the brain, guess what happened? Immediately, the lattice lock happened. So we saved somebody a cric. So when these things happen in my career, in surgery, these are lessons that a surgeon has to take in. And, if you're a centralized surgeon, you're going to hear this and go, yeah, that's happened to some of my patients. But I didn't really understand what was going on because you didn't understand the biophysics. So the reason why this becomes important, because our patients that aren't anesthetized, that are in your clinic, that you're doing manipulations on, when you do these manipulations and you feel like you're doing a good job and they're not getting better, you got to ask the same question that Uncle Jack asked of that patient with laryngospasm. Is there something else that I could do to actually improve my manual therapy so that it's effective? Because the thing that you never got taught, and why I'm spending time talking to you about this, is if you don't know that your patient's lattice lock before they come in and you start manipulating them, will your therapy be as effective? The answer is no. So it doesn't mean that you're a terrible clinician. What it means is you probably didn't read my blogs. You probably didn't listen to what I was telling you. Why? Because the lessons that I learned in surgery for lattice lock people were incredible. And I'll tell you, the people that taught me the most, and I'm talking patients now, about lattice lock and deuterated water tables are people with dementia. So the most common operation that I had to do, probably the 40 years when I was doing a lot of neurosurgery, was people with frontal temporal dysplasia, Alzheimer's, also Parkinson's, that had normal pressure hydrocephalus. So we would have to go in and put a shunt in. And a shunt is a pretty simple operation. We just put a hole in your head, put a tube in, run the tube down your neck, and it drains into your belly to get rid of it. The problem was I was never taught that if the CSF in the brain is kind of like maple syrup, that it's not going to run so good. And you start figuring this out as a neurosurgeon after you're in practice about 5 or 6 years, because right at where we put the hole in the head, there's a valve. We used to use a low pressure valve, a medium pressure valve, and then a high pressure valve. Now we have programmable shunts, so you can set it with a magnet outside the head, so it's even easier. But what I realized, there was a lot of people that failed even with low pressure shunts. And I started putting two and two together. I noticed that all my failures were always in people that had dementia. And what was the correlate to that? These people we would do surgery on. This is what I would call a very simple surgery for a neurosurgeon. It's nowhere near like what it is to do a brain tumor or an aneurysm or an AVM. These people would be fucking zonked. I mean, when I tell you zonked, the anesthesiologist couldn't reverse the effect. So we had to put them in the ICU overnight, and it took a whole 24 hours to actually reverse them. So what does that tell you? That the amount of deuterium in their CSF, that oxygen deuterium bond, was off the fucking chain. And sometimes we even had to keep the people on the vent with high FiO2s before it would go. How did I learn about the sodium chloride thing? This is kind of funny. And some people think it's terrible, but you know, I don't like to be woken up in the middle of the night. And I kept thinking to myself, well, if I keep doing these shunts and these fucking nurses keep calling me in the middle of the night, I'm going to stop doing these surgeries. So then I came up with the idea. I said, you know what? I'm going to start bolusing all my patients with 3% sodium. There's another thing I noticed on these patients before I did it. Almost all of them had low potassiums. And then I started to put two and two together. I started to remember some of the things that Gilbert Ling talked about in his work. He wrote some very interesting books in the 50s and 60s. He was probably even more controversial than I am, which makes me feel like he's a kindred spirit. But he came up with something called the association induction hypothesis, and he had a lot of interesting things to say about potassium. But what's the key take home for Ling's work? That potassium is what structures the water. And what did I add to Ling's work? Where did Ling end and where did Jack pick up? Turns out that potassium and melanin are doing one and the same thing. So what did I realize? That everybody who's demented, who I'm putting a shunt in, who's lattice locked, if I bolus them with sodium chloride is something that can free up, that oxygen deuterium bond. So what eventually happened? My patients began to wake up 2, 3, 4 hours after anesthesia. And then I could transfer them out of the ICU so the nurses wouldn't be calling me all night. So really, I did it to protect my circadian biology because it got to be to the point where if you know how ICU nurses are, they call you for every little fiddle fart, okay? Especially when it's a neurosurgery case, because those are the ones that make them kind of nervous,
Yeah.
And when I started doing this, I got the idea, well, why am I just doing this on dementia patients? Why don't I start doing this on everybody? And it turns out the patient I just told you that got laryngospasm, that is the reason why I went to use it on someone who didn't have dementia. I said, well, if it works in somebody who's demented, it should really work on somebody who's not. And it turned out I was correct. And what did that make me do? I didn't do what normal centralized doc would do. I went and started reading more about why it happened. And it took me a long time to figure this out. But why this is important for you is remember this lattice lock and the collagen issue is tied to why we wake up every morning as well. It's called the cortisol activation response, and it has a lot to do with the stretching of water and collagen when we wake up every morning. It turns out your brain has something in it that actually defrags its lattice from sleep. And it changes the magnetic polarity of the CSF in your brain. Who found all this out? That was Robert O. Becker. And the funny thing is, when he found it out, he didn't even like go and study it further because he didn't care. He just cared that he could put, a salamander to sleep and cut their arm off using a magnet instead of having to, get inhalational gases in to do this. But I remember reading his papers going, is this guy for real? He found this out and he didn't even want to study it. And it's the truth. He didn't, but it made huge sense to me because I began to see how patients with laryngospasm, patients with emergent delirium, people that that had dementia, they basically were all deuterated before they ever came to the doctor. And if the doctor doesn't know that their patient has this, the doctor is impotent to fix it. And, let's fast forward now to 2026, because now I'm going to tell you how important this is. So we have a lot of people right now that get a small injury. And I'll tell you the last one that just happened. Some kid named Mason in Akron, Ohio. He played a baseball game and did real well, had no problem during the game, goes home 3, 4 hours later. He gets horrible nausea and starts puking. Then immediately 2 or 3 hours later, he goes brain dead. And he gets transferred to the children's hospital in Akron, and the doctors, were impotent to fix him. So this is the reason why I'm bringing this story up to you because how can a normal, healthy kid go from playing a baseball game to lattice lock? And I'll explain it to you really quickly because it's gonna actually affect, I think, the patients that you see. What do you do when you play baseball? You're doing a lot of metabolic activity. So if you're doing a lot of metabolic activity and you're already deuterated, what are you doing? You're destroying a lot of the nanomotor engines in the ATPase. So what was the sign that something was magically wrong? His CSF vortex between the third and fourth ventricle is connected by an aqueduct. If you know anything about the aqueduct, it's long and skinny. That's called the Venturi effect in biophysics. It's designed to speed the vortex up so it pushes the deuterium out, and the center channel is all H plus. Well, what happens when the center channel is filled with D plus? It hits the floor of the fourth ventricle and it makes you puke. That's where the chemotactic center for vomiting is. But the problem was the doctors that took care of him in Ohio, they didn't know this. Okay. So why did the kid become brain dead? Was he really brain dead? The answer is no. He was completely lattice locked. In other words, his water table became so deuterated everywhere, his muscles, his brain, that when the neurosurgeons came and evaluated him, he looked like he was brain dead. So this is happening in a lot of places in the United States right now. And you hear these doctors. There's especially one doctor that really aggravates me because she's bringing highlights that this stuff happens, but she's blaming hospitals for stealing people's organs. And she doesn't realize that the reason why these people wake up when they go to organ procurement, this is the biggest lesson ever. Because what do we do when we harvest organs? We give them dopamine and epinephrine to keep the organs alive. Guess what that does? It defrags them. So here's the thing about the critics. They're so fucking stupid that they don't realize what's happening right in front of them, and they immediately want to blame the hospitals and the neurosurgeons for trying to steal your fucking kidneys. They're not doing it. They're actually telling you they're fucking stupid. They don't understand what's going on. And the reason why it's a big deal to me is because I don't want to see a lot of young people who normally would not get this problem. But it also tells you that most of our patients now are deuterated before they come in. So why is this a big deal for you to hear? I guarantee you that 75% of the people that are coming into your office, they have this problem. Like, I'll give you the perfect example. Everybody who listens to this, if you get muscle cramps in the middle of the night that wake you up, you have a deuterium problem. That's what, now, anybody who listens to this is probably going, okay, so that's what restless leg syndrome is. Yes, it is. Okay. And when you hear this, you start going, wow. And then you realize what's the treatment for all this stuff that you get in centralized medicine versus what you and I are talking now. And that's the reason why this random walk between two clinicians who are in different fields, but I'm telling you my observations as a neurosurgeon, and I'm explaining to you because you're not going to see it in the acute setting. You're going to see it in the chronic setting, but you need to be aware of this because if you see somebody with this, you may start saying to people who come in to see you for, I don't know, a ligament tear or a cervical instability, hey, do you get muscle spasms in the middle of the night? Well, my favorite one is the bro science guys that are all using creatine, especially the creeper stuff. Bro, I can't tell you how many professional athletes have come in lattice locked that I've seen. I'm not kidding you. I get calls from their orthopedic surgeons, and I tell them exactly what to do. And magically it goes away. I said, tell them to fucking stop using creatine. Because creatine is the fastest way to increase deuterium in your water table.
Because it just pulls everything in.
Correct. Well, it's not just that. It has a lot of effects. I'm going to put a blog out on it very, very soon. But what's the major effect? The major effect is it makes you feel better short term. But what does it do? It's just like the kid I told you in Ohio who was able to play a baseball game, do perfectly fine. And then 2 or 3 hours later, the effect of the bonding of oxygen to deuterium takes in and you become acutely lattice locked. They don't realize that exercise stimulates the lattice lock because metabolic rate increases what? The RPMs. Well, if your RPMs get taken down because all the water is deuterated around them, should be no surprise why this is happening. But you would be stunned how many of these NBA players, because the NBA players by far get this more than the NFL or the NHL. And I think part of the reason for that is they are doing more acute, hardcore stuff, short term, and almost everything they do is inside under blue light. They never ground. Let me just tell you some NBA players, when you talk to them about grounding, like, bro, I got to wear my shoes. I'm like, fuck you.
Gnarliest you'll ever see.
Right. It's like NBA players have been so bought by Nike and by Rockefeller Medicine, and they never fucking question anything they're told. Instead, what are they doing? They're looking for the next bro science thing, a creeper or, fucking peptides in the gym, which are also deuterated. I've actually taken care of a couple of professional athletes that went on peptides. They got Lattice locked from that, and they couldn't figure out why they were having a problem. So the reason this is a big deal, you may see people that come to see you, and look, you can look like you're in phenomenal shape. Most of the professional athletes I take care of, they look like Adonis. But guess what? They're all falling apart. And the interesting thing is, many of them, the number one thing you see, if you test for it, neurocognitively, they're all impaired because their brains can't spin as fast as they should, the 9,000 RPMs per minute. But the other thing is, if you ever do a thermogram on them or a HRV, and I started doing that, I'm going to say probably 10 years ago, and a lot of them didn't understand. I told them with a thermogram checks basically the viscosity of water. And most centralized docs don't understand that. And I said, look, if I do a thermogram and it shows that you don't have a thermal change where the blood flow is, that tells me that there's a problem with the vortex. And how do I back that up? Then I do an HRV. And what do I find in the HRV? It's less chaotic. Then you know that their water table is deuterated and their z-axis is fucked. And the last thing you can do is you can do an EKG and look for signs of cardiomyopathy. And this, a lot of people started getting clued into this because of COVID with the jab injuries, but people have mixed the COVID injuries with this problem. And I'm going to tell you, this problem started before the COVID jabs. The COVID jabs act just like an increase of metabolism, like the baseball player I told you. Why? Because the spike protein affects the inner mitochondrial membrane. What does it do? It lowers the 30 million volt charge. Well, if that happens, what is that? That simulates a metabolic, change. So that's the reason why many of the people that have their heart stop on them, and this is what it's from. It's actually from acute lattice lock within the cardiac muscle, but nobody realizes it. And a lot of these people are being treated really badly. And it's because they're staying in the Rockefeller paradigm of biochemistry, and they're not in the decentralized medical paradigm of biophysics. And they need to, especially these days. Why? Because now we have pretty strong evidence from USGS, swarm data. Now we got a magnetic excursion ongoing. The SAA is growing like crazy. So you have to realize, why am I telling you this as a physical therapist? I want everybody to pay attention. The NFL is now expanding their schedule internationally, and guess where they're doing a lot of their games? Right in the middle of the SAA. So guess what? I'm going to make a prediction. Y'all keep your eyes open about what happens in September and October when all these fuckers go down to Brazil, Mexico. I got news for you. If I'm an NFL team and I'm the doctor on that team, make sure you bring a lot of 250 cc bags of sodium chloride and large bore IVs. And make sure you're really good about popping IVs because you're going to need it. I would tell every player that listens to this, all my players that contracted me, I tell them all now to get EpiPens. I said, put it in your pocket. If you ever get lattice lock, you tell people you're allergic to, I don't know, your job, whatever you want to tell them. But the main thing I don't want them to wind up in, I don't want to wind up in the ICU, and their families being told they're brain dead. That's the real key here. And if you can prove to people that these simple little things work, because we know they work in the anesthesia side, but nobody is putting it, in the healthy metabolic side, because everybody who thinks they're healthy really isn't healthy at a biophysical level. Because when your water table is deuterated, it means your collagen can't work. That's what it means.
So with all this, Dr. Creed, my big thing that I'm coming up, like as a manual therapist, then when you're talking the ventricles, right? Like we can do different ventricle holds to help pump the CSF, right? So we can do different heart
But you got to do
mobilization.
you got to defrag them before you do that. Like,
Well, and that's what I want to get into a little bit.
yeah,
Like I want to have a better understanding of that because I'm looking at this, okay, I want to be doing my CV4 holds on everybody, making sure that I'm moving that now. I want to be getting into there, doing the heart mobilizations that I can do, right? Going along the vagus nerve, doing that, right? Like going into the sphenoid. Like I'm already looking at some of those things, right? So now, my other thing that I want to kind of get in there too, because if I'm looking at just optimal conditions when somebody is even just here on the table, right? I'm not always having them necessarily grounded outside when I'm working on them, but can I lay down uh,
yes,
lava
you
rock,
should.
right? Like, can I get that kind
Actually,
of
you
stuff on
should
the
ground them.
table?
If you want to know the truth, I would tell you to take your manual therapy table. I have one, just so you know, here,
Oh,
where we drilled a hole through the wood,
yeah,
uh, and put copper studs, and then on the table is a big sheet of copper. You can ground them. Also, I mean, I could show you. This is my new retreat area that we're building. You see
yeah,
the grass down there?
yeah,
That grass has dirt from a basalt volcano beneath it. So, like every time a patient walks here,
yeah.
they're actually doing manual therapy just by walking. So, anything that you can do to increase the piezo and flexoelectric or pyroelectricity in your patient's collagen, you're helping them with. The other thing I would tell you to do too, if you have a recalcitrant case, I would tell you to start using deuterium depleted water. I'll give you another one. If they don't have the money to pay for the deuterium depleted water, get them to drink carbonated water. I don't care what kind, it doesn't matter. Carbonated water also increases their magnetic effect in their body. And what does it do? It actually helps defrag them. You may not know this, but if you've been a member of mine for long enough, back 20, 25 years ago when I started all this, I told people I spent almost $200,000 translating Russian papers. What I found out is that the Russians, when it was still the USSR, before Gorbachev took the wall down, they used to have these carbonated machines all over Russia, and they gave free carbonated water to all their people. Now, I just did a podcast about a week ago that you probably haven't listened to, about MK Ultra, but in it, I told them the reason the Russians started this is Becker did some work with DARPA on their three cosmonauts that died in 1971. One of the things I noticed in the literature for the Russians is after these guys died, the first thing they did, they started studying carbonated water. So why do I think they gave carbonated water to everybody on the surface? I think the Russians realized from the EMF risk that people had on the planet, they were like astronauts on the planet. So if you could treat everybody with CO2 water down below, that the chance of people getting lattice locked in space would go down. And I think it's been one of the effects that I've seen in space stuff from the ESA and also the Russians, not NASA. NASA is not on this at all. They're doing stupider stuff. They're trying to put astronauts on Vasper, which is a special exercise in space that actually creates lattice lock.
Yeah, I had the
People,
inventor on a few years ago, right? I remember talking to him. Yeah,
yeah, well, I'm gonna tell you the Artemis 2 astronaut that just came back. She got space ataxia. I don't know if you
yeah,
saw the
yeah.
video. That's exactly what you and I are talking about now, because she's kicking deuterium down. It's going through the obex and it's affecting the posterior cord. That's why she got the ataxia. It's a cerebellar posterior cord disease. And they have no idea what they're doing, but the Russians did because of those three cosmonauts that died in 71. But I thought it was the most interesting thing. The Russians always favored physics over pharmacy. In the United States, we've always favored pharmacy over physics because of the Rockefeller dynasty. And I'm going to tell you that I got clued into the use of CO2 in water from the Russians. And it's part of the reason any one of my patients who knows me, they always see me with carbonated water. Like if I go out to dinner, I'm drinking carbonated water. And they understand now why I'm doing it. Why? Because I believe we've been in a magnetic excursion for about 5,200 years. And there's a lot of evidence throughout older civilizations that this has happened. And I think we're in one of the asymptotic stages now. What do I think we're going to see? I told you before we came on this podcast that I think one of the things that we're going to begin to see is we're going to see way more patients with EDS-like symptoms. But the number one thing I've told my neurosurgery friends to pay attention to, if you ever have live vaginal births with kids born with cone heads, where the cone goes up and the cone does not come down, that is a sure sign that that mother and that environment doesn't have enough telluric currents. And I'll explain to you what telluric currents are. These are currents that come from space or come from the magnetic dynamo to actually shrink the bone down. You know, as a physical therapist, that babies don't have sutures that are solid. But what usually happens when you leave the baby alone, the head size normalizes, and then eventually the sutures begin to heal. There's evidence, especially in the what I like to call the West Coast of the SAA, that anywhere between 10 and 5,000 years ago in the deserts of Peru, that babies were being born routinely with these type of heads. And what's the reason why? It's what I told you before, that the number one amino acid that actually lattice locks the triple helix of collagen is called hydroxyproline. And hydroxyproline, when it is absolutely tied to triplet oxygen. So if you don't have triplet oxygen because you're in the middle of a magnetic excursion, or just say you got a ton of EMF around you, or you don't do any grounding, you're by definition going to have shitty collagen. Not only will you have a deuterated water table, but I'm talking now the biophysics of your collagen is defective. Why is this a big deal for you? Because you're seeing all these people with defective collagen, and you may not realize the link between hydroxyproline and triplet oxygen. Because remember, everybody who learns about oxygen, they learn about paramagnetism, but you know what they never tell you? That singlet oxygen is actually the thing that causes entropic fires. This is actually what gets you sick. So here's the thing. Oxygen on Earth with a strong dynamo always stays in the triplet state. When a dynamo weakens, it can't. What does that mean? If you have singlet oxygen in your system, things that rely on it won't work. And that is the difference between biochemistry and biophysics. You can see the atom in the biochemical thing, but if you don't know what the spin state is, you don't have a fucking clue what's really going on with the patient. And the thing is, why is this a big deal for me and you? Because if we, like for me, it was a huge deal in the examples that I gave you. When I saw somebody have a singlet state crisis, if I wasn't able to think on my feet, these people would have wound up with a crike. They would have wound up with, in the fucking ICU. There would have been a whole bunch of other kind of shit happen. I remember when I told you before, like with vasospasm or emergent delirium, we gave them 100% oxygen. Remember, the oxygen we're giving them is triplet state. Got it? So just remember, you assume the oxygen in your patients is the same as the oxygen in a tank. It ain't. And guess what? That little idea, when you share it with the anesthesiologist, they start looking at it. Like all my anesthesiologists thought I was crazy. And then when they started seeing it, they would come up to me and say, you know what? Your little trick that you told me, it worked. Like, it's amazing. And the amount of people that had to go to the ICU, magically dropped. The amount of laryngospasm cases that anesthesia started seeing also went down. And I said, anybody who comes in who you think's got a deuterated water table, which is basically people with neurodegeneration or significant heart disease, I said, anytime we put someone to sleep, their blood pressure drops. I said, what you should do as soon as you see the blood pressure drop, don't give them a bag, because they used to give them a full bag of sodium chloride. I said, hit them with 250 or 500 cc's of sodium chloride. Watch what happens. their blood pressure will fucking respond beautifully. And they look at me like I'm crazy. I said, do you know any of the studies from the heart? The people on the heart transplant list, you know what they treat dilated cardiomyopathy with? Fucking 3% sodium. And when you see it and you go, well, why are we doing it in this group, but we're not doing it for other people? I'm trying to tell you why. When you're a biochemist, billiard ball thinker, and you're not thinking about the spin state of electrons, and what are the things that, at least in the brain, that control spin state of electrons? It's called cis. Those are chiral molecules. What are the two that I know you've heard of, but may not know how it fits? Melanin, which we talked about earlier, and the other one is ApoE. And what is ApoE in? It's in cholesterol. What is the thalamus all made of? It's made of fucking magnetic fats, DHA, and cholesterol. So it turns out ApoE is a chiral molecule as well. So when you understand this, you start going, wait a minute. If all this ApoE and melanin are destroyed because these people are pseudo-hypoxic, which is what a deuterated water table means, these people are coming in and they're actually going to cause a problem when we do surgery on them. And the reason why I think I was able to understand this is because I'm the guy who took care of really big problems on an acute basis. And I would tell you, even with trauma. And when this happens in a trauma case, dude, it's devastating. Because if you don't know what's going on, that's a patient that is going to die on the operating room table. So you have to know what is really going on. And I will tell you, in my opinion, we're killing a lot of people in acute trauma situations because we don't understand this effect. Now, the reason why this effect is hidden in trauma cases is because trauma cases, we give a lot of blood products, we give a lot of this, that. All those things defrag people. Remember, it changes the biophysics right away. But in your case, in your office, you're not doing a lot of that. You're doing manipulations. So what you need to be, you're not going to see the acute phase shifts. You're going to see more of the chronic ones. And those are people that you're doing this stuff and you're like, why aren't they getting better? You know, I'm doing everything I'm supposed to be doing. Why aren't they getting better? What I'm asking you to do is kind of what I did, you know, in my practice 30 years ago. Start asking better questions of yourself and go, well, maybe if I try to defrag them before I do it, like simple things like we've already talked about, using DDW, using mastic gum, using an EpiPen. The other one you can do is put a TENS unit on either side of the terion, put them on. That's a pretty slick one to do. I'll give you another one. You probably have never thought about this, but if you really want to stimulate, get, you know, the long Q-tips that ENT guys have. They're like this fucking long. Dip it in something nasty, like real bitter. Put it on the back of their tongue. That's where the bitter receptors are. That will stimulate the gag reflex. Guess what? You defrag them that way.
What about, so I've done like C1 mobilizations like intraorally. Would that do the same thing? Because like you have to get
If they
past the
don't, if
gag
they have a
reflex.
good gag reflex, yeah, but you want to make them gag.
Okay. No, because
Because
that's I'll glove up and do that kind of stuff too.
the
Yeah.
gag acts just like, you know, when we talk, people forget the reason why the heart has an asymmetric innervation. The right side runs in the tracheoesophageal groove. The left side runs around the arch of the aorta at the ductus arteriosus. The reason why we're built that way is because we're the primates that talk. So every time your heart beats, you're defragging the left hemisphere. The right vagus nerve defrags the right side of the brain. But what does the right vagus do different than the left? The left vagus is predominantly a heart muscle. The right side does the lungs and all the intra-abdominal organs. So where you put like the vagus nerve stimulator depends on the patient's symptoms. You know, I've gotten so sophisticated.
Left versus right, you're saying.
Yeah.
Okay.
I've gotten so sophisticated that I tell people which side to defrag more than another, because it turns out most people are on the cognitive side. That's going to be Broca's area and cognition. But if people have all these mental disorders and things like that, turns out their right side is heavily deuterated. So you start on that side. Then there's some people who are totally fucked. You need to do both sides. And then you teach them all the different ways to do this. And I would tell you, the first visit with you, I would say, hey, look, tell them, I'm going to do a really detailed history on you. Going to find out what's going on. If you have any clue that these people may have a deuterated water table, you should fucking spend your first 2 or 3 visits just fucking hitting them with tens units.
I mean, I don't even think it's looking and seeing if they do. They do. Like, it's
Well, I
really,
agree with you, but I'm trying to be nice.
yeah. No, to me, it's just like, no. So I also want to be clear on this, right? I would initiate treatment with that then, right? Like that's just always going
I
to be
would.
consistent.
That's. I mean, I'm gonna be honest with you. When people come to see me now,
Yeah.
to me, it's obvious. Like, I'll give you an example. Right now in Costa del Sol, I have a patient down here on the beach. I'm not going to tell you his name, but he's got a significant neurodegenerative disorder. He hasn't been able to walk in 3 years. He hasn't been able to talk in a year. Okay. He's been down here 6.5 weeks. Okay. Doing a lot of the things that you and I are talking about, but I'm adding some pretty slick things. He's now walking 100 meters on the beach and he's talking. Now, I got to be honest with you. The only time that I had that effect on this condition is when I had to do functional neurosurgery, meaning put a wire in their brain and using a DC current to stimulate this out. What is the DC current doing? It's defragging that part of the brain. So I got the brilliant idea when I was a younger doctor. I said, why the fuck am I drilling holes in people's heads? Why don't I try to do this without drilling a hole in their head? That's where I famously came up with the saying from my TED talk that got banned. It's brain surgery without a scalpel. And when you begin to realize how this works, you start doing things and see how people respond. So if you want to know the truth, Nick, when this guy's wife called me up and I told her what to do, I said, look, I think he may be too far gone because he's in the end stages of the disease. I said, but do I believe you need to come to a place like this and do this protocol specifically? And I said, if he does decent, then I'm going to add other layers to the onion. Well, he did, and I added other layers to the onion, and he's gotten fucking better and better and better and better. The last one I just added, he went from 50 meters to 100 meters. And now, one of the guys who works for me, his wife is now his caretaker. She's documenting this for me with videos. And the reason why this is a good thing for us to talk about, it also gives me positive feedback that when I take somebody from another zip code and put them in this zip code, and I can actually see evidence of biophysical photo repair in someone who's a train wreck, that tells me a lot about my environment right here. Okay. And it's kind of similar to what you said to me before about your manual therapy table. Like, are there things like you can't change your zip code of your office, but what could you do? You could run fucking copper wire through that window there and run it right up the table and make sure that it's connected to some kind of piezoelectric blanket that you put your patients on while you're doing manipulations. Guess what? Nick just became a better therapist than he was a year ago. Why? Because he understands the biophysics of collagen and water better. And ultimately, my goal, especially when it comes to clinicians, I want to teach them this stuff. The problem is I don't get in depth with a lot of this stuff like when I do podcasts, because I think people need to learn this stuff. You need to learn the biophysics first before we have these kind of discussions. And I hate to tell you, this goes to the deuteration of CSF. Most people don't want to fucking do the work because they're all fucking brain damaged and they don't want to hear it. And I'm like, well, sorry. I look at it like this. If you want the best of Jack Kruse, you're going to fucking come up to my level and you're going to start doing things right. It turns out the only people that tend to really do it is when they get like this guy and they're like this far away holding on the edge of a coffin. And can you imagine how successful we would be if we got somebody like when they just started having muscle cramps in their calf at night? Or, hey,
No, not even symptoms, like just somebody who's
just say
young
on an
kid, just
ultrasound,
starting to do it then.
I have some cavitation in my Achilles. Okay, we need to work on you because you're getting ready to rip that fucking Achilles in half. Like that kind of stuff. Or if you got somebody with RA and they got cervical instability on their flex and extension views, say, hey, look, before we do an occipital cervical fusion with the neurosurgeon, let Nick fuck around with you a little bit. We may be able to tighten those ligaments up when we get rid of the deuterium that's in them. But
not to mention like cold plunging for instabilities is incredible though. Like,
yeah, but try to put a lady with RA that's got that problem in cold water. Tell me how that goes. Yeah. They cry like little babies.
So
All of them have cold intolerance because they don't have any magnetic facts in their body. Like they don't have enough DHA, they don't have enough ApoE, they don't have enough cholesterol. Usually, most of them are eating like fucking rabbits, because that's what they feel best with. Why? Because they're running off a metabolism that's almost glucose. Why? Because their triplet state is gone. But nobody seems to understand. That's what a Warburg metabolism is. It's a metabolism that can't work off a triplet state. It's a singlet state. What does that make? It makes entropy. It makes inflammation. But you have these retard biochemists out there telling you that, well, all oxygen is the same. They're fucking retarded. And you got to stop listening to them. Like, this is the reason why guys like Thomas Siegfried drive me fucking crazy. Because he doesn't even fucking know what he doesn't know. I just got into it with Chris Masterjohn on Twitter, I don't know, 5-6 days ago about this. And I think Chris is a really smart guy. He's really good, but he's a fucking biochemist. He doesn't know shit about biophysics. He's starting to. And I think the reason he's starting to learn is because he's decentralizing his money with Bitcoin. So I think he's starting to add some of this going, well, how can I be better for my clients that I'm talking to? Because he's kind of doing the same thing you're doing. You're trying to improve the outcome for your clients. And I think, when I see somebody trying to do that, I like to go above and beyond. What I don't like is when somebody comes and does a podcast with me and basically just steals all the info, tells people the info, and fucking gets it wrong. And then people get fucked up and they say, oh, this biophysics stuff is quacky. And guess what? Unfortunately, that's what most of the influencers do. Why? Because if you remember what you said to me in the beginning of this, said, Jack, everybody seems to get the light. They're starting to understand the water, but nobody fucking understands the magnetism. What am I telling you, Nick? You got to understand all. And guess what? You got to understand how they fit together. Because if you don't, you're going to hurt somebody.
So, Jack, I two that I almost want to go into, right? Okay, if I'm not moving where I live right now, I look at this, somebody who has 1 acre, 10 acres, a million acres. How can you get the most magnetic flux on that land possible? So, and I want to preface this. I just started. One thing
I'm going to tell you. I want to preface this before I say it.
Yeah.
If you live in a magnetically declined area, meaning there's an excursion going on. So let's be very clear about this, because I know most of your people are going to be from the U.S. Where that area exists right now is South America. The SAA now covers almost the whole continent with the exception of Patagonia, and it goes all the way to Africa. So we're talking a massive part of the globe, okay? The northern extent is now going into the North Atlantic Ocean. So the people that live on the eastern seaboard, they got a big problem. Why? Because if you remember what I told you in the beginning of this podcast, that the dynamo links to the currents in the ocean, not the tectonic plates.
Right.
The largest thermohaline current off the East Coast is called the AMOC. AMOC has been studied by NOAA, USGS, and now SWARM. It's been shown to be 50% reduced. So what does that mean? That means if you're a fisherman and you go out, the fish that used to be this big are now this big. Why? Because the oxygen dissolved in the water. The triplet state oxygen is down. What's in the water now is singlet state. Fish can't grow big, okay, without that oxygen.
Above them, even.
Right. So what does it also mean? Those fish have more deuterium in their skins and their meat when you eat them. So guess what the answer is? Once you know this, and you know this effect is there, how do we clear deuterium? Because that's the next part of the story. Melanin. Melanin defrags deuterium. Why? Melanin is a chemical that pays attention to the nuclear magnetic moment of the hydrogen isotopes. That's the reason why where melanin is in your body is critical, because it helps keep the deuterium in the blood so that you can get rid of it through the blood vortex, the CSF vortex, but then out the vagus nerve. So how can you increase your magnetic sense if you're in the place you are? Understand what I just told you and make the spinning of the vortex in the heart and the CSF more effective. So the things that we've already talked about will do that. What's the other big issue. How do you make melanin, Nick? You make it from light. Well, if you happen to live in a declined area, are you going to make as much melanin? No. Melanin, just like hydroxyproline, requires triplet state oxygen. So you have to find a place that you make enough triplet state oxygen, the magnetic dynamo is not collapsed fully, so that you can support making melanin. Because if you do that, you can pretty much live anywhere. Because even if you eat fucking coconut water, which is a deuterium bomb, or fruit, which is a deuterium bomb, you should be able to clear it through the vagus. The things that you and I have already talked about, like the trans auricular, which you just put on your ear like a TENS unit, you can use a TENS unit everywhere. If I showed you my pool that I built here, I put a pool in with an extra strong pump. You know, when the water comes out, I have my patients put their spines right against it to defrag them when they're sitting in the pool. And what's on the edge of the pool? Basalt volcanic lava, so they ground. So they put their hands on it and they're getting pounded right in their CSF. Why am I doing that? Because those are all the people that have the deuterium that's getting down to the OBEX. So who's that really important for? That's important for people like with neuromuscular problems, Tarloff cysts, ALS, even muscular dystrophy, any kind of musculoskeletal pathology. Do I want them standing right next to this before I'm doing anything on them? Yeah, because what am I trying to do? Deuterium deplete them. So those things increase your magnetic sense. The things I told you the Russians were doing with carbonated water, mastic gum, anything you can do to improve vagal function. Believe it or not, rub in your eyes. You have something called the white rami communicante on cranial nerve number 3. It innervates the socket. When you do that, you're stimulating the vagus nerve when you do it. Can you do carotid massage? You can. All these things actually work, but you need to understand that your patient's level of deuteration is something that is not going to be significant, meaning the same 2 people in the same house can have radically different water tables. So what I do when the case is really difficult, I'll usually send them for either MRIs or thermograms to really look for the problem. Those are the ones like the guy that I told you down here. He was obvious because of the state that he was in, but he was close to dying. And even in someone who's close to death, when you can see an improvement of 5 or 6 weeks, and, you know, a lot of neurosurgeons would say, what I did for this guy was like hocus pocus. Well, it's hocus pocus when you don't understand the biophysics. But when you do understand the biophysics and you see this kind of change, and I didn't have to drill a hole in his head to get it, you can increase your magnetic sense a lot of ways. What's another way? A magnetico sleep pad. Now, I have not got into this on the blogs yet, but I'm getting ready to. So I'm probably going to give you a little gift here in the podcast. So about 20 years ago, one of my members, who's no longer a member, she did a consult with her husband and me. They both were government employees. They worked, how shall we say, for the bad guys. Okay. And they were working in the Pentagon. And I casually mentioned to her that I happened to sleep on a Magnetico sleep pad. And she goes, well, why aren't you telling everybody this? And I said, well, part of the reason I'm not telling everybody this is because they're expensive and I don't think people are going to be able to buy it, da, 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 da. And she goes, well, why are you doing that? I said, well, it's one of the best ways to increase your magnetic sense when you're sleeping. Now, I never really got into why I got this idea, but the current blogs that are being put out now, I'm talking a lot about these ancient civilizations. So if you knew me back then, you would know that through lots of podcasts that I did, old ones, I always made the comment, the last day Chichen Itza was open, I took my young son, he was probably 5, 6 years old at the time. He's now 32. So you can tell how long ago this was. And it's the last time you're able to climb on Chichen Itza with the rope to go up there and also go to El Caracol, which is the observatory right next to it. What was my goal of going up there? My goal was to scrape the inside walls of the pyramid, specifically where they were doing most of the ritual sacrifice, because there's a big rock there. And I was very interested in the rock and I was interested in the wall. And the cool thing is Mexico used to fucking let you do whatever you want. So I went up there with a test tube with my little son, and he's climbing up there, and he has no idea. It was just me and him. We're the only two going up. So I got the samples, sent it off. I took samples from El Caracol, also did some measurements because I was very interested in the measurements of the window because I thought that there was a specific reason the Mayans built it the way they did because they were looking at Venus and it's tied to equinoxes. So if you know anything about the Mayans, they were what made them really special from a science perspective. They were experts at understanding magnetism and the stars. Okay. They really were amazing. You know, the stuff that you probably heard is about the Mayan calendar and everything was supposed to end on December 21st, 2012. Well, it turns out they might have been right, but you don't know the reason why. That's when the magnetic decline, that's when the North Pole started fucking running like crazy from Canada to Siberia. But what did I want to go see? I started to put things together and I said, if El Caracol was built to somehow figure out how magnetic excursions happen, they had to have a way to make the inside of the observatory electromagnetically quiet. What's the best way to do that? To use rare earth elements. And why would the rare earth elements make sense here? Because the area where the Maya were around Chichen Itza got hit with a fucking asteroid 666 million years ago. And guess what? The four key rare earth elements that a Magnetico sleep pad is made out of, got it, are in the walls and the rock that was on there. And what did I find? I found a lot of neodymium. I found a lot of samarium. I found a lot of the lanthanides that was in the inside concrete that was painted. Like there was still some paint inside. There was Mayan blue on the rock. And of course, I scraped that up and I started to realize what they were doing. Well, what's the key take home that you need to know? The rare earth elements allow you to have magnetic flux in a warm, wet environment. It's the only four atoms on the periodic table that do that. Why? You said something earlier that should stimulate. You know that when you put a lady with, a nasty neck in cold water, that you can tighten them up and deuterium deplete them, right? Because that's tied to the Curie temperature. That's what my cold thermogenesis protocol is all about when I wrote it in 2005. Well, right around this time, I said, I got a funny feeling that the Maya were doing something different. So what did they do in the inside of Caracol? They were following Venus like crazy to see evidence of a magnetic excursion. And they were able to trap it. They were actually able to track it. And how did they do it? From the center part of the observatory, there was a big hook coming down, and they used a lodestone, which is anti-ferromagnetic. And what were they doing? They were looking at auroras in the sky and figuring out where the poles were moving. And what did they also do? All of the things that they used on the inside of the buildings in Chichen Itza, especially the pyramid that's there, the pyramid is built over a cenote. All the pyramids that are there, all four directions, east, west, north, and south, also have smaller pyramids. So they'll be using the fracture lines from the asteroid to measure telluric currents coming from inside the dynamo and marrying it with the stuff in space. And what were they using to quiet their temples? They were using rare earth elements in their plaster, but they had no idea what was in it. They had no idea that an asteroid once hit the planet in that era. But here's the interesting thing. The archaeologists that I talked to back then, they told me that the plaster that they used to paint with these pigments didn't come from Chichen Itza. It came from 30 kilometers away. Why? Because they knew there was something special about the dirt there. So I went to that place, and what did I find out? That place was loaded with the rare earth elements. So let's do a hard stop. You just saw Donald Trump tell you that they're building this huge military bunker under the White House, right? What else has he been telling you? He's interested in Greenland. You know what's in the tip of Greenland? A place called Terbank? The largest amount of rare earth elements on the fucking planet. Got it? Now they're going to tell you it's because of semiconductors and they're trying to help China out. I'm going to fucking tell you something different, brother. Okay? Because it turns out, I think the United States government is making a fucking magnetical sleep pad underneath the fucking White House. That's what I think's going on. How's that?
Well, I mean, Jack, I both love and hate you right now because I'm about to go put that on my credit card, right? It's like it's one of the things like I've been like, oh, it's a tough one. It's a tough one. It's like I just got to do it. But
Well,
now,
I'm going to tell you the
oh,
reason why
go
you
ahead.
want it. I'm going to tell you
Yeah.
the reason why you want it because I haven't said this publicly. The reason why you want it, because I don't think for your lifetime and my lifetime, it's going to be a big deal. But I do think your kids, their kids, or the kids behind it, because I do think we're closer than we all want to know of dealing with what the people in Paracas, the people in Egypt, the people in the Caucasus, these are all humans that existed from the last Chap event, which was the really last big excursion. That's where Neanderthals became us. Um, I believe the Mayans figured out that the last cycle, which has been about 5,200 years, they knew that it was going to end on 2012. Most people haven't put together yet that all this data with the SAA and the movement of the magnetic north began in 2012 at that equinox. They knew the winter equinox was when the process would go asymptotic. And the interesting thing is the United States government has been really quiet about this whole thing. But now it's pretty obvious that something has magically changed. Why? Because the swarm satellites have just come out and told us the SAA now is 3 times as big as it was the last time we looked. And now it's split and it's going to Africa. Remember what I just told you? I think the SAA is just like the red spot on Jupiter. It's a magnetic vortex. You see it on the surface of Jupiter because it's a gas giant. We're a rocky planet, so ours is at the core mantle boundary. But what is the history, I think, of eukaryotes? Is that this SAA has gotten bigger and smaller over the last 780,000 years. But where we pick it up as Homo, the last Champ event, which is 42,000 years ago, Neanderthals become us. But what's the in-between step? The people that lived on the east and west coast of the SAA. That's the Egyptians and the people in Paracas. And they magically have these skulls that look elongated. Well, you haven't asked me this yet, so I'm going to tell you. Why would a skull elongate? The part you're interested in is because of the hydroxyproline, no triplet state oxygen, so it weakens collagen. But why would a human have that? Well, I told you the answer. Because it steepens the incline of the ventricular system. It makes the Venturi effect greater so that you can handle a deuterated water table. You want to hear the funny thing is? Do you know that the Egyptian pyramids at Giza, they have a 52% slope,
Yeah.
right? But the Egyptians went away. Do you know who built more pyramids than the Egyptians? The Nubians. And remember, the Nubians come from Sudan. They were the darkest people in the world, so they had a lot of melanin. The Egyptians die out. The Nubians start making their pyramids. They make 228 of them. And you know what the slope of their pyramids are? 70 degrees. Do you know what the slope of King Tut's skull was and his father and mother? 70 degrees. Do you know what all the Paracas, Peruvian skulls were in infants? Just so you know, the story from archaeology, and I want to make sure you get this. Yeah. Story from archaeology is that they bound their heads up with boards and wrapped them.
I can still picture it in my books from school. Yeah,
Oh,
yeah.
wait a minute. I'm going to give you the fucking hammer time. There's evidence in Peru, which I went to examine, that fetuses were born with these. So what does that tell you? You can't wrap a fetus head. And it turns out the Field Museum at Pennsylvania has 2 of these skulls. Okay? 2 skulls that are in infants and babies. And there's evidence down in Paracas, which you can go to. I was just there not even a year ago. There's a seaside museum that has the pictures of the mummified fetuses with these heads. They look like aliens. And, a lot of the idiots out there want to tell you, oh, these are evidence of aliens. No, this is evidence that these kids had a version of severe EDS without the disease. And I'm going to tell you the most important part that you'll be the most interested in. Probably why I'm sharing it with you. The thing that's made these skulls very interesting, they seem in Peru not to have a sagittal suture. So what have the archaeologists and the biologists talked about? They're like, oh, well, this has to be some kind of genetic defect. No, it turns out it's not. What happens when you have a Warburg shift from no triplet state because the magnetic excursion goes on? Guess what happens? You get atavism. You go back in time. So you're not going to have the need for a sagittal suture because remember, what was the story of Homo africanus all the way up to Neanderthalis? Increase of skull size. What happens when you go back the other way? You go down, so you're not going to have a need for a fucking sagittal suture because you don't have a big brain. Got it? So guess what we're seeing evidence of in Peru? I don't believe the Peruvians, the skulls are only 6,000 years old, like they tell you. I think they're probably dated back to the Younger Dryas, probably 12 to 14,000 years. Why do I believe that? Because do I believe the Incas got this message from these people who are right on the Andes Mountain? That's the reason why Machu Picchu is built the way it is. So you ask me another question, Jack, how can we improve our situation? Go back and look at all the ancient cultures. You know, you'll find out that most of these skulls were found inside of piezoelectric volcanic lava. Why? Because they do the same thing collagen does. It creates an electromagnetic zone that protects you from the tritium that will come down. Why do you have to avoid tritium and deuterium? Deuterium, I already told you the answer. It's because of the food. But what does tritium do? It's a radioactive isotope of hydrogen. When you get it intercalated into your methyl groups or your collagen or anything else, it's radioactive. It breaks down via beta decay. You will die very, very quickly. You want to know why we don't know about in archaeology? The half-life of tritium is 12.3 years. So it goes away. And you know what the remnant of it is? Helium-3, which floats away into the atmosphere. So you will never see the isotopic feature of it. But let me tell you how detailed I've been. This will really make you fucking lose your mind. I wrote a letter. I'm going to say, I think it was 10, 12 years ago, to a guy at the University of Cincinnati. And I told him, I think you should go back to Tikal. And just so you know, Tikal is in Guatemala. When the Mayans left El Salvador, went to Guatemala, and then they left Guatemala and went to Chichen Itza, they evacuated out of Tikal. What's special about Tikal? The slope of its pyramid is 70, just like the Nubians. Shocking, huh? You know, I went to Tikal and scraped that pyramid too and found the same fucking thing that I found at Chichen Itza. But then I went the next step, something I couldn't do on my own. I wrote him a letter and said, look, I'd like you to go to the pools at the base of Tikal, sample the DNA, look for cyanobacteria. And I said, the other thing I want you to look for is deuterium. Do a deuterium fractionation story. And then I think you should look for mercury. So don't you think in 2000, right before COVID, guy from the University of Cincinnati goes up there and reports in the literature, we found something interesting in the pools of Tikal, that there was huge amounts of cyanobacteria, huge amounts of deuterium, and mercury in the pools. So what am I trying to tell you? I'm trying to tell you the reason that they evacuated is even though they were doing a lot right with the rare earth elements, what's the big difference between the Mayans and everybody else? Because remember, the Mayans are the one group that got through the excursion. They, just so you know, I live in a country right now where there's Mayans all around. There's a guy right now, a Mayan, that's cleaning my pool. Okay. So they didn't die out. They came back from Chichen Itza back here and they started a new civilization in Kuslatan. Okay. Here's the interesting part of the story. Why did I know to look for cyanobacteria? What did I tell you earlier in this podcast? How did the great oxygenation event start on Earth? Cyanobacteria photosynthetically made oxygen. So if you reverse the process, the water should be heavily deuterated, right? and it should have cyanobacteria in it. If you get cyanobacteria on you, one drop, you're dead. It's very toxic to you. Okay. It's a big toxin. But it turns out that that toxin was able to make 21% oxygen for us. The other big issue that I was very, very interested in with the Mayans at Tikal is I wanted evidence that the reason they had to leave was there's no rivers in the Riviera Maya. You may not know this, but the Riviera Maya is the one part of the world that has no river system, no reservoirs. What were the reservoirs? The cenotes that were created in the limestone karst from the asteroid. So guess what? There was no way for them to improve their water supply. That is the reason why they had to pick up and leave. And where did they go? They went back where they came from 4,000 years ago to El Salvador. Why? Because they magnetically pinned themselves on the volcano. Got it? So guess why the real reason you may need that Magnetico? Because I think you're going to rip the Magnetico apart and break the fucking magnets down and make little pieces and parts, and you can make plaster and put it on the inside of your house. So I want you to take a look behind my left shoulder. Do you notice what's on the clinic building there? Laha basalt lava rock filled with rare earth elements. How do you like that? And do you know when I put it on the building? You go inside the clinic now, it echoes. Just like what happened at the ball field in Cancun. I should say not Cancun, in Chichen Itza. The ball field looks directly across from Chichen Itza. And famously, if you go in there, it's a huge field. If you talk into the wall on one side, you can hear it on the other. Why? It's a magnetic acoustic effect. You can look it up. So all the lessons that I learned now, that's how you increase your magnetic pinning. You take things from the volcano that can help you when the shit begins to hit the fan, because that's exactly what the people in Spain did. It's exactly what the people in the Caucasus did. It's exactly what the pyramids and the Egyptians tried. It's what the Nubians did. They were trying to improve their water. And you may be even further shocked. If you get water that runs down a 70-degree incline, do you know that it increases the dielectric constant of the water because it gets rid of the deuterium through mechanical vibration? Oh, we're back to your world again. So it's a way for them to defrag their water by actually running it through a steep slope. And why didn't the Egyptians make sense of this? Because their pyramids were 52 degrees. Doesn't work at 52 degrees.
Now I gotta go. Like I hike every week and get my water at the top of a mountain, and I gotta measure to see what the angles. Like I'm like because as it pours off, like I'm gonna see where it's pouring off at the steepest angle there and start
I
harvesting
got news
that
for you.
spot.
We have we have a pretty famous volcano, a pretty famous story of what I did here when I first moved here. I sat down with President Bukele in his house, and he told me a story of his family. Like he wanted to build a coffee finca because it's something he's always wanted to do. But the place that he had his eye on, everybody told him not to buy, because they like him. Normally, if they didn't like him, they probably would have told him to buy it anyway. But he said, Jack, they told me not to buy it because the water's bad. And I said, well, I kind of understand why. I said, but the water table here is deeper. If you look at your volcanoes, they run like bowling alleys on either side, the north side and the south side of the country. See, this land is right in the middle. So it just means that you have to dig deeper. And I said, the reason that you haven't been able to find water there is you don't have an oil and gas industry here. So you need to go deeper and you'll get the deuterium depleted water. Well, he goes, how do you know? I said, well, I went up to Metapan, which is 5,000 feet in the air. This is at the border of Honduras and Guatemala. I found a fucking vent kicking out water that's 120 parts per million. And I said, that water shouldn't exist on this planet. Why? Because the hydrology cycle says that the water should be around 150, 155 inside the tropics. I said, that water has been underground for millions of years, and it's been pumped and vortexed by the volcano. And guess what? It comes out of a volcano. Guess what the slope is? 73 degrees. And just so you know, my friend owns the volcano. I go in a pool that's right below it. I took some of that and sent it back to the United States and to be tested. And I told Bukele, I said, you dig deeper and you're going to find water. I said, this whole fucking country is loaded with great water. The problem is you haven't tapped it yet. I said, but when you tap it, so Nick, another answer to your question. If you live in a place that's got a lot of volcanoes and has good groundwater, that's another way to increase your magnetic sense. It's a way to improve your collagen further. So there's a lot of ways to do it, but guess what? You got to leave the bullshit fucking Rockefeller biochemistry because it's not about billiard balls, dude. It's about the electronic spins of atoms on the periodic table and how they act. And it turns out what makes the rare earth elements really, really special is most of them are 3+ oxidation state. They can completely replace calcium in the cell. What's the second messenger in the cell that you learned about as a physical therapist? Calcium. So guess what it does? It magnetically changes the free radicals that are made in your body. So there's other effects.
All right, Jack. Because I think you started talking about this too, and I almost don't want to miss the chance to ask you right now. Other ways you were talking about deuterium depleting on other podcasts that I've been listening to, you said psychedelics and cannabis.
Yeah. Yeah, they help. The reason why, like, cannabis is an effect, and I don't think people really. I think the one guy that I would tell everybody to follow about cannabis is Kevin McKiernan, because most people know. I think Kevin is a great guy, but he's also done humanity a big service by testing the jabs and everything for SV40. But he runs a cannabis business, and he's trying to put all the genomes of cannabis online so that future generations will have this. But it's pretty clear we have an endocannabinoid system in us. And what happens when we have any injuries, that includes your patients or mine, the endocannabinoid system gets increased in us to act like spackle on the central nervous system and the peripheral nervous system to help us photo repair. So in other words, what does it do? It gives you more time to heal. Kind of like if you go back and read Becker's work, he always said that the reason why mammals don't heal like amphibians is because the blastema doesn't stay out long enough. It turns out the endocannabinoid system is one of those systems that improves our ability to heal. Okay. So in a stress state, that's the reason why cannabis can help. What does it do? It does affect the dielectric constant of water around cells, but it also has a lot of other effects. It's not just a one effect kind of deal. Now, the mushrooms, specifically LSD, that's a different issue.
Wait,
That,
sorry, mushrooms or LSD?
yeah, but I'm talking about both. They both have the
Oh, okay,
same
no
kind of
problem.
effect. They're massive. They have massive ability to defrag water, but they also have other effects. So to use this, if you use too high a dose, you're going to fry your brain and can become like Sid Barrett of Pink Floyd. You don't want to do that. You want to use micro doses, and I think a lot of people are beginning to see that with the use of ketamine and Diprovan. That's actually what Michael Jackson, doctor, was doing. Who got thrown in jail. Uh, they had no idea what they were doing, but they were technically trying to defrag his water base. And remember how he died? He died of cardiac failure, which ties back to the Z axis that I was telling you. His heart just stopped because he had no magnetic flux in his body. And if you think about it, he bleached all his body because he had vitiligo, which is also the melanin problem. So you start seeing it and you go, Jesus Christ, it's all the pieces and parts are there. But the issue is the mushrooms act just like 100% oxygen did. The problem is the therapeutic index of mushrooms and LSD is very much smaller than oxygen is. You know that 100% oxygen also can be a toxin. We know that from NASA when they burned up all the astronauts in the 1960s and 70s. But we use 100% oxygen in anesthesia for this reason, because it's the safer version of LSD and ketamine and Diprovan. And that's also the reason why anesthesiologists really like Diprovan, because they'll tell you once they turn it on, we call it the milk of amnesia. You turn it on and people go down. As soon as you turn it off, they wake up. You don't have to defrag them. Why? Because it doesn't have a big effect on the water table. And most of them don't understand the reason why. It's part of the reason why a lot of the drugs out there that are illicit drugs actually help people do it. It's also the reason why so many people now are using marijuana, so many people are using THC, so many people are using CBD because they're, as you said, they're all deuterated. Like they know that it helps them. They have no fucking idea why. The only thing they have to do is fight with centralized pricks with MDs that say, "Oh, you're a fucking idiot," or they have to fight with Alex Berenson, used to be a New York Times reporter who's always giving Kevin McKiernan shit. but this guy's a fucking retard. He doesn't know what he's talking about. Kevin does. And Kevin is trying to help, people with this issue. I don't even think Kevin understands, the biophysics tied to this. But soon, I would tell you probably the back half of this year, I'll have a full endocannabinoid series of blogs out there that explain how all this happens. You just happen to be the guy who asked the right questions today to get some of the information out about these things. So when you understand that my hacking of the periodic table when I was a young man was the key for me putting this all together. Like I told you, the rare earth elements are in some of these chemicals. Like you'll be very, very surprised. Some of these are contaminants. And it turns out the 4D shells of these electrons are really, really important for the magnetic effects. So the best way for you to understand it is know that the ancients, they didn't know quantum mechanics. They didn't know periodic table. You know what they did know? They knew that these rocks somehow improved the water in and around their environments so that they didn't get sick, because they saw animals drink out of cenotes and drink out of rivers when the animals died. So what did they do? They started putting these huge paramagnetic blocks of basalt lava, and they were able to purify it. The Mayans even went on the next level. They actually use zeolite. Zeolite is part of the volcanic ejectant, in and around where they live. They use that just like we would use charcoal to clean water. And what was the number one effect that zeolite had? It actually got rid of the cyanobacteria problem, which is part of the reason why I asked the researcher to go and look for ridiculous levels of cyanobacteria, because that would explain why they had to abandon the pyramid. Why? Because the pyramid could only get water from the cenotes. And the Mayans knew that the cenotes were special. The Mayans even knew that in the base of the sacred cenote, if you ever go visit it, you'll find there's a whole bunch of Mayan blue, like 5 meters thick of it. They'll tell you that's because those are all the sacrificed people. Mayan blue is loaded with rare earth elements. When you throw Mayan blue in the water, it doesn't dissolve. It stays on. So it's still there to this day. They have no idea that they were magnetically purifying the water. But what's the key for the water in the cenotes, in case you don't know? There's a very cool cenote that you should take a trip to someday because you'll really dig it. It's called Sakaktoon. Sakaktoon is in the middle of, well, the last time I went, it's in the middle of a fucking jungle. They just found it relatively recently. But I went when I was doing this hack fucking 15, 20 years ago. I went in the middle of the jungle with a guy that I used to hire in Mexico named Senor Kruse. And he took me to Sakaktoon. And it was here that I found a place where I could go down and see where the salt water met the cenote water. And it turns out, remember I told you the story about telluric currents? They are affected by space and by the earth. The Maya knew about this place. When you go there and you see it, you see the difference between salt water and the cenote water. There's a line in the water that you can see when you put a flashlight on it. And why is that important? Because the telluric currents of the crust mantle boundary come and connect to sea currents, which is why I told you about AMOC. The Maya knew to build all their cenotes over, I should say, build all their pyramids over the cenotes, because it turned out the power of the magnetic dynamo would always keep the water relatively clean, because they knew that the water was coming from the rain. The problem was, in a magnetic excursion, the rainwater got polluted by tritium and deuterium. And that's how I knew to look for cyanobacteria, because what happens? Cyanobacteria grows best in highly deuterated water. That's how I knew to ask the question. Because remember, it's the reverse process of what happened in the Great Oxygenation Event. Cyanobacteria was in deuterium depleted water, but made triplet oxygen, which is what we breathe now. It was not on the planet in Archean or Hadrian Earth. Cyanobacteria they're specialists in making triplet oxygen. So the proof that I was right about this, and that centralized archaeology and biology is wrong, is to go back and prove that cyanobacteria and deuterium were in the pools of Tikal. Now that data is out there. So yeah, when you understand biophysics, you know the fucking questions to ask. And it turns out most of the people that are billiard ball biochemists, they have no fucking clue what me and you were talking about. That's the reason why they can't fix people with collagen vascular diseases. They can't fix people in your clinic. They can't figure out why Tyreek Hill popped his Achilles in Miami when the fucking whole place is deuterated. And he's eating out of that. It didn't happen in Kansas City. You should ask yourself why. What's the difference? Because everybody would say, well, Kansas City should be worse than Miami. It turns out it's not true. And, you know, let me just tell you how incredibly important this is. I'm going to give you, an American, a history lesson. In 1860, Ulysses S. Grant hired John Wesley Powell to go check the Louisiana Purchase that we got in 1801, okay? He wanted to know about the water table of the Louisiana Purchase. And what he found from John Wesley Powell was the 100th meridian. That's the longitude. Anything west of that was a desert. Anything east of it was good. He goes back and tells Ulysses S. Grant, because I think you just bought the richest fucking farmland in the world. But here's the story you need to pay attention to. Since 1860, remember what I just said in another podcast? 1859, a Carrington event happens when we get hit with a CME. And I said in that podcast that the sun is talking to the dynamo, and you thought I was crazy. I just told you about telluric currents. 2 ways to do it. I just showed you what the Mayans were doing. Now the flip side is the sun affects this from space through the auroras. And when the auroras come really low, you know that the magnetic field isn't good. So we knew in 1859 there was already a problem, but the government never really told you that, okay? So what has happened with John Wesley Powell's data from 1860? You remember when you were a little boy, Tornado Alley was always based over Tulsa, Oklahoma. Tornado Alley is now over Nashville, Tennessee. It's moving east. You know why? Because the water table is becoming deuterated. So guess what? The reason why Tyreek Hill got popped with his Achilles tendon is because it turns out, if you do the math, which I've done, John Wesley Powell's number is now 90 west. It's now no longer 100 west. So what does that mean? The entire east coast of the United States has got a new problem that nobody wants to talk about. So if you want to know the real reason why the government got involved with Rockefeller Biotechnology and Monsanto, which is a melanin competitive inhibitor, remember, that further deuterates the table. So you'd start asking yourself this question: why would a government or corporation do that? Well, when you got 8 billion people on the planet and you know what may be coming, and you want to build a big old fucking crater underneath the White House filled with rare earth elements from the tip of fucking Greenland, you might want to learn a little bit about the Mayans. That's all I'm saying.
I mean, Jack, now it's just right. Like they're trying to build their own pyramid. Like that's really what this is coming down to, though.
Thank
Yeah.
you. Guess what? And you want to hear the funny thing that you just said, and I'm glad you opened the store. Now I'm going to really give you a lesson. So if you look at the first pyramids the Egyptians ever made, you remember they're step pyramids.
Right.
Okay. One is called Pyramid of Bent, and the other one is Mesidor. They were failed step pyramids because they had problems with the casing, but they also had problems with the mud they were using. Okay. But the interesting thing is they're step pyramids. Now, once you go down to the Nazca people in Peru, they have these things called poquinos. Okay. And they're spiral holes that are stepped that go in the ground right where the water sources are. So you know what that means? The pyramids were built over where the Egyptians had water sources, but in the northern hemisphere, because of the Coriolis effect, they build up because the vortex had to be the opposite way. In the southern hemisphere, the people that predated the Incas knew to build theirs into the ground, so the vortex went this way so that they could keep the water table clean, because the Coriolis effects spins the opposite way in the southern hemisphere. So if you were to look at the poquinos, well, if you look at the poquinos in your head and you flip them upside down, they look just like the two first pyramids that the Egyptians built. How do you like that? So guess what this was about? This was about using paramagnetic blocks over water sources. Why? Because you would be able to keep the water table clear of tritium. That was the fucking key. Okay? Once you see it for what it is, then you begin to go, okay, I live, I don't know, let's say Kansas. There's no fucking paramagnetic rocks here. So why the fuck would you want to stay there? In Florida, it's all fucking limestone like it is down there, but they didn't get hit with an asteroid. Riviera Maya did. There's no rare earth elements there. Why is the government all of a sudden magically excited about rare earth elements? You think it's about fucking iPhones. I don't. Okay? I do not. And it makes total sense. As soon as they said they were interested in Greenland, my bells went off because I happen to know that the Greenland tectonic sheet is 4 billion years old. It's the oldest fucking part of the crust that hasn't been subducted yet. It has the highest amount of rare earths on it. But guess what? It's buried under the ice. And guess what's happening now? The Arctic is melting. Okay? So eventually, all that's going to be harvestable. So that is the reason why the industrial military complex wants an unending source, because remember, not only is your survival at risk, so is theirs. The only thing is they know the truth. You don't. You're seeing it every day in people that walk in your clinic going, why are these people's collagen falling apart? And I just told you the answer. It's because singlet oxygen is becoming rare, and singlet oxygen links directly to dynamo power. And I have that proof now. I used to tell people this, but I didn't have the paper proving it until June 3rd, 2025. And I got to be honest with you, Nick, since that paper has come out, I become a really big pain in the ass for people because I'm pointing something out now where this is no longer Jack Kruse's beliefs. This is fact. And now I'm telling you all the reasons that led me to believe it was true is because the deep dives I did on all the ancient civilizations, they all had something in common. And they were all dealing with paramagnetic rock. Okay? That is the key. And once you understand that oxygen is the only paramagnetic gas on the periodic table, doesn't take a fucking rocket science to figure out what they were doing. Okay? It's pretty fucking obvious. And you don't have to have an advanced physics knowledge to figure it out. Why? Because if you're animals and you drink it, you look and say, look, they didn't fucking die. That's the acid test, as far as I'm concerned, in a clinical trial. And when the water did kill people, what did they do? They moved to Chichen Itza from Copan and Tikal. And remember, they're the only ancient people that didn't go extinct. Everybody else did. The Neanderthals are no longer here to tell their story. The Peruvians and Paracas, they're no longer here. The Nubians, no. The Egyptians, no. And there's mysteries around all of these places. That look, the Dolina in Spain, it's just got dated to like, I think 18,000 years ago. If you go look at this fucking thing, it's a giant underground paramagnetic lava-based thing that could fit 20,000 people. What's in Göbekli Tepe? The same fucking thing. Okay? Like how many times that you got to be shown the same story and only a retard is going to believe that it's fucking aliens? You know? I have no time for those people. What I'm saying to you is that eukaryotes in the Homo species have dealt with numerous magnetic excursions. And the evidence is we haven't done a good job of it until we got to the Mayans. Now I think, since at least 1859 and John Wesley Powell's information, I think through space technology, through NASA, through Swarm, the United States government has a pretty good fucking idea how to attack this problem. They're just not telling you. So what's my answer to you? You want to improve your neck and you got an autoimmune condition that's ruining your ligaments? Magnetically pin yourself by ground. The real reason you need a magnetico, you may have to break that magnetico up someday into rocks and fucking put it all over yourself and put it in your gardens and put it all around you. Maybe do what I did and take a look at the building back there. It's in everything that's on my buildings. Like, not to be a total asshole here, but look, around the pool. See the guys putting it on the walls back there? It's fucking everywhere. Every house that I'm building down here, I'm putting it everywhere. Why? Because the people that come here to heal, what did I tell you? I'm trying to heal their dielectric constant and their collagen before I do anything else. Well, just by virtue of staying here, I'm doing that. Like you had the idea to magnetically pin your table. I'm magnetically pinning my whole entire fucking clinic.
Well, and I've been thinking about this. Like when I've been starting to go to the hardware store anytime, I start getting bags of lava rock now because I'm putting it around like my garden or I'm
Just
gonna.
make sure it's real.
Okay.
That you really do need to do that, but I will tell
Yeah.
you, it's a good idea. I think you also need to become very familiar with like what is good basalt lava closest to your zip code. Like for example, in the United States, the best stuff is in the Pacific Northwest. Um, there's really no other part of the United States where it's great. There's some decent granite in the Northeast, but the problem is the Northeast has really bad sun, so you can't make the melanin to get rid of the deuterium. So you have to realize that the three-legged stool that I always talk about, light, water, magnetism, you have to have every single one to a certain degree. And it turns out right now, because the dynamo is getting weaker, like this is the information that the influencers, the PhDs, the retards that are out there, they don't really understand that if you have a stable dynamo, light is the most important, then comes water, and then magnetism. Guess what just happened? The swarm data just told us everything changed. Now, magnetic flux is going, and it's not something that's tied to humans. This is tied to planetary cycles that the Mayans clearly tapped into. That's why they built their buildings the way they did. So you have to realize that your government is not telling you the truth about this. And most of what I told you today is now discoverable. You can go and look for all this information. So the real key question for you is, why am I really recommending a Magnetico now? It's not to sleep on. I think you need your own stable amount of rare earths because you and your family may need that down the road. That's the real reason you want it. Like, in other words, I want you to look at your neodymium magnets in the Magnetico like the government used to look like a gold at Fort Knox, because that's how important it might be.
I mean, this is your Bitcoin. This is your like same
Well,
concept.
I don't
Like
think it's going to be my Bitcoin because I don't think my life is at risk for what happened to the other ancient civilizations. But do I think my lineage is? Yes. Do I think a lot of my clients' kids, do I think a lot of the people that I'm taking care of right now have effects? Do I think a lot of the people that you're seeing in your clinic, can their story be told through this biophysical lens? The answer is yes. And I think it's also the reason why there's so many failures in centralized medicine, because this is a hidden variable. This isn't like a variable that's not controlled for, that nobody else understands. Because when a biochemist talks about oxygen, they don't talk about the triplet or the singlet state. They have no fucking idea. And the difference between those two, one is entropy and the other one is coherence. Like if you have triplet state oxygen, that's how you build quantum coherence in tissue. If you have singlet state oxygen, that's actually how you build inflammatory fires. And I don't think people have been educated enough about that single fact. And when you are, you start to go, well, maybe Jack wasn't as crazy as we thought he was. Because you begin to look into it and you go, wow. And then when you start to see the evidence lay up, remember when I started this, Nick, 25 years ago, I know that a lot of people thought this was crazy, but 25 years later, there is so much wind behind my sails. Like, I'm getting sick of being right. You want to know the truth? That's the truth. But I knew I was going to be right, because if I was wrong, there would have been a lot of people wrong. Like, who built the periodic table? Who informed Mother Nature? You know, who talked to Einstein? Who talked to Feynman? Because everything that I believe isn't from my head. It's actually the lessons that I've learned from nature and being observant. Like, I decided as a young man to be as observant as the ancient cultures, because I thought it was amazing that they did the things they did with as little science as possible. And I do look at the destruction of the Library of Alexandria now, as the single biggest problem for modern human history. Because I think a lot of this ancient wisdom was in the Library of Alexandria,
I
and
was
it
just
was
talking
burned.
about this with a patient yesterday, actually,
Yeah,
that exact topic.
yeah, and I think a lot of this was in there. And I'm going to tell you, I haven't told you this, but I probably should because the blog's already out. Let me tell you just how smart these people were. Um, so I just told people in a blog that there's a link between the Mayans, the Egyptians, by the Nubians, and you know that the Nubians, I've talked about them in other podcasts from a guy named Peter Unger. He's good friends with one of my friends I went to dental school with, named John Sorrentino, who's a dentist in New York. And Unger went to the side of the Sphinx, pulled all these guys' skulls out, and he found that they had perfect skulls, perfect dentition. So this kind of proves the point that you don't need a fucking dentist, you know, if you're doing things right, because this is before dental toothpaste and fucking brushing your teeth and flossing and all that. But there was something more interesting when I did the deep dive into Unger's work. I found this Greek guy who did something even more amazing. He found the skeletons, not the skulls now, the skeletons, and he fluoresced them under UV light, and he found they all glowed uh, yellow and green. And then he went the next step, hired a pharmaceutical company to use hydrogen fluoride to break all the bones down. And guess what he found? Every single Nubian bone was infiltrated with tetracycline. And I'm going, wait a minute. Fucking tetracycline was discovered in like 1950s and 60s. How the fuck did this happen? And I learned about this, you know, I'm going to tell you, I don't know, it's probably like the 90s or 2000s. And I thought it was spectacular. So I then went to deep dive and looked at texts from the Middle East because, you know, the Nubians did a lot of work in the Middle East. I found in ancient Islamic texts from Jordanian doctors that people who are Nubian never got certain diseases. And all their bones were loaded with tetracycline. Then it dawned on me, because I used to be a dentist. I said, if you give a baby tetracycline, it stains their teeth. This mimics exactly what the Maya did. You know what the Maya used to do? They used to put jade on their teeth. Jade is piezoelectric. So if you got it into the dentin, that information went straight through Meckel's cave. They defragged themselves that way. I realized the Nubians did it a different way. They did it with tetracycline because it dopes the dentin and enamel on their teeth. So every time they bite, they're defragging Meckel's cave. So I said, okay, I got to figure out how they did this. So it turns out they made this beer, and the beer was contaminated with a bacteria that makes tetracycline. And what did they do? They used the culture of the beer over and over and over again to keep making the beer. That's the reason why the Nubians were so much better than the Egyptians were, who were dying. And what did that allow them to do? They're the ones that figured out the issue with the water table because their pyramids were built at 70. Well, it went anywhere from 68 to 73 degrees, all the ones I went to check on. Mm-hmm. And then I said, the reason they were more hardy and lived through this excursion longer is because they fucking basically defragged their whole skeleton. Every time they did any exercise, bit their teeth, they were deuterating, or I should say, defragging the deuteration in their water table. I was like, bro, this is exactly the same thing that shows up 3,000 years later with the Mayans when they're putting fucking jade on their body and on their teeth. I'm like, it's the same fucking story. So when you see this and you realize that these ancient cultures knew way more, they may not have known why, but we figured out the why later. So here's the lesson for people who listen to this podcast. I gave you a lot of ideas to defrag, a lot. So how about you start fucking using some of them before you come bother me and Nick? Because guess what?
Start with one. Start with one every time. Start somewhere.
Right. Yeah, you when you see this, I mean, how hard is chewing mastic gum?
I think I'm
You
gonna
know,
just start putting it up front and like just put it for sale for everybody. Like, yeah,
I think it's a smart move. But you know, when you think about exercise, exercise in a normal state is a good thing. Is exercise in a deuterated state a good thing? No, it can kill you. That's the kid's story in Akron, Ohio. And I want people, you know, my critics think that I'm anti-exercise. No, I'm anti-exercise because I know all the patients are fucking deuterated. That's the real problem. And then why do these guys push creatine and peptides? Because they're all deuterated and they get the short-term benefit, but they don't understand the long-term risk. But I'm seeing the long-term risk come in NBA players that come in and they can't move their bodies. You want to know why Celine Dion's got stiff man person? There's your answer. You want to know why Jordan Peterson's got the problem he's got? There's your answer. But these people don't want to know the truth. They want to keep fucking buying the illusion of the Rockefeller paradigm that biochemistry, food, and fucking supplements somehow is going to make a difference. I got some bad news for you. None of those things change the spin of oxygen. None of them affects the paramagnetic atoms in their body. And it's about time fucking people realize that, because that really is the story of how you can take a normal collagen and absolutely destroy it by one single thing. The same thing is true at melanin. We lose melanin the same way we lose collagen, and people don't understand it. So you have to have a little bit of every stool. You have to have light, you have to have water, and you have to have magnetism. You have to have them all. You can't have good or great 2 and shitty 3. No, it doesn't work like that. Okay? And the influencers, the PhDs, the fucking retards you're listening to, they're wrong. And I'm going to keep telling you they're wrong. I'm going to tell you why they're wrong. I'm going to do podcasts like this. I'm going to force you. I'm going to put my fingers in your nose and get you really close and say, listen to what the fuck I'm saying. Okay? Because when I'm dead, I think a lot of people are going to want this information, because you're not getting this information from the people with MDs, PhDs, influencers. No one has done the dive that I've done. No one. Why? Because I knew we were being lied to from the beginning. The people in power, the industrial military complex, DARPA, they don't want everybody to survive. You got to remember, if the dynamo continues the way it's going, say it gets to be really bad like it did at last champ, you have 8 billion people that are going to be running to every place where they can magnetically pin. You know what that's going to do to resources?
Not a lot of land mass with that available.
You got it. And I guess that's the take home. So I think the more that you can do where you are in the zip code now by this artificial pinning, because that's what the ancients are teaching us. Yeah. They were able to do quite a bit. I think you need to learn those lessons.
And they still survived it.
Well, the Mayans did.
I'm looking at like Göbekli Tepe, like thinking of something like that.
Right. You know. Right. And not only that, it's pretty clear that Göbekli Tepe, they're probably the most advanced of all of them. But I would tell people to look, like just on my Twitter feed, I'm starting to put all these ancient sites down and showing you the biophysics of what was there. You're going to see common ties. It's always tied to paramagnetic volcanic stones. Like even the sarcophaguses that are in the Valley of Kings, just so you know, there's no fucking volcanoes there. But guess what? Some of these sarcophagus in the Valley of Kings were between 50 and 80 tons. In 1933, there's a report from a guy that found it that there was 7 of these there. Now there's only 2.
Okay, Jack, that's even something like I saw a Stargate show not recently, like fairly recently, right? Like where they're like going through Stargates, this and the other, and they're having these people sleep in these sarcophagi with all these stones and minerals and stuff. I'm like, where is that on Earth? Like, why aren't we developing those things too?
I'll be honest with you. This is the interesting thing. I'm convinced the people that stole these things out of the Valley of Kings, these were people that knew about this science from the government. But you know what that is? It's the ultimate Faraday cage. It becomes electromagnetically quiet. So just think about the advantage of having something like that in your house. Like it wouldn't surprise me if Bill Gates or Jeff Bezos or Elon Musk has got, 3 of those missing 5 sarcophagus. Why? Because you could easily retrofit it to put singlet oxygen in. You could do that for a long time. It won't surprise me either if some of these underground bunkers that the military's got, that these are all lined with paramagnetic basalt lava. Is it the reason why I think some of our nuclear arsenal that's underground is also in some of these places like Colorado? Problem is Colorado's mountains, the Rocky Mountains, are unzipping right now. Most people don't know that. And the real risk of the West, from I'd say really the whole United States, with the exception of the Pacific Northwest, is that the water table is completely deuterated. So what does the military have to do? They have to create reverse osmosis water. And believe it or not, the government about 15 years ago, now I'm going to say it's 20 years ago now. No, I'm lying to you. It's actually 35. In the Gulf War, when we first started seeing PTSD in soldiers, what did they start doing? They started making RO water and giving it to the guys out in the desert. What did they find? People that were coming back in the theater didn't have as much PTSD. The problem became um, they didn't want that information getting out, because if it got out, people would be like, okay, that's potentially a hack for a magnetic excursion. So RO water is big. So I'm going to tell you that's the reason why I think the military took out Iran's RO stuff in this Israeli war, because they know what it means. The Iranians clearly know what this is all about. And just so you know, to show you how powerful this, one of the rivers that's running through Iran and Iraq, which goes back to the beginning of what we call modern civilization, that water has dried up now. So I'm going to tell you that the water table in the Middle East is actually getting worse. Now, there's a lot of water under the ground in the Middle East, and there's some interesting things that are happening on the Nubian plate right now, the tectonic plate. The eastern slope of it is in big trouble. That's where the Azores are. But the west side, which is in Africa, is opening up. It's splitting open. What's going to happen eventually? The Sea of Oman and the Red Sea are going to dump into us. You're going to have a new ocean. People don't know this. Before the Egyptians, there used to be an ocean there. How do we know that? When the oil and gas people from Saudi Arabia started digging into the Sahara, we found fucking seashells, 20, I think it was 2,000 kilometers under the sand. So that there used to be an ocean there. And what's happening now is the tectonic plates, as we're going through this excursion, the Nubian plate is getting ready to slip into the Atlantic Ocean. But that means the western side is opening up. So guess what? The water source that the Egyptians lost when the plates closed is now getting ready to come back. So this is how you know it's a cycle. And now the effect is greater, right now in South America, but is the tip of Africa now getting hit? Do I believe that this is going to go up the east coast of Africa into the North Atlantic? Yeah. And my prediction, this is one of the things I'll agree with President Trump on, because I don't agree with him much now. He made a comment about a year ago, and it was a very flippant comment, but I think, people will go back and remember it. It was the people that were talking about climate change, and they were saying, oh, everything's getting hotter. And he said, yeah, well, my scientists are telling me that things may get a lot colder. And what was Trump telling you? It told me right away that he knew that we were in a magnetic excursion and AMOC was dying, because if AMOC dies, guess what happens to Europe? They fucking freeze. You get a mini ice age. And because all the warm water that was coming up, it's going to be isotopically hot. Or is there evidence that we have that the Younger Dryas, which was about 12,000 years ago, that Europe was basically frozen solid? The answer is yes. And this is the reason why some of these places that are in Spain that nobody wants to talk about, there's some rocks in Spain that are 180 tons big that are carved by humans. Guess what the slope inside it is? 70 degrees. So you got to start asking a question, Nick. Like, does nature make any mistakes? I told Huberman no. And when you keep seeing the same thing show up in all these different places, but nobody's putting it together, you may want to realize, no, these are not biochemical issues. These are all biophysical issues. And when you link it together for yourself, what is a podcast like this for? Hopefully it's for physical therapists realize and surgeons realize why some of their patients are coming in already damaged, so that we can be smarter to help these people out. But what is, I think, the bigger part of the podcast, at least maybe the last half of it, we're giving people clues and tools that they can use to increase their magnetic sense and magnetically pin themselves. Because you want to know the truth of the future. My belief is you need to be magnetically sovereign. Like your zip code, you have to start thinking about this. And I think magnetic sovereignty likely will come from economic sovereignty. Why? Because that's exactly what the United States is telling you about the tip of Greenland. Okay. And even though we have a ton of natural resources in the United States, we have one big problem. We're turning into the Sahara Desert. The southeast of the United States is turning into the Sahara. And when that happens in the next, I don't know, 500, 250, 500,000 years, I don't think people are going to be able to live. And remember, most of our population is east of the Mississippi. I don't know how long the excursions going to last, but the Mayans seem to think, based on their calendar, the one that they lived through um, was going on about 5,125 years. And the reason I think they were the most accurate is for the reasons that I told you. They were using all the appropriate physics to not only look at telluric currents from below, but also in the sky. And they were able to figure out with extreme precision. Like if you know anything about the Mayans, everything they did was mathematically precise. So from my way of looking at things, I put a lot of faith in them that I don't put in a lot of the other ancient civilizations. I think a lot of the other ancient civilizations had a lot right, but I will tell you, I think we're still in the same excursion they were in. I just think the SAA shrunk down after them, and now I think it's gotten bigger. And I think what they were telling us or leading me to believe is that the next time the SAA gets bigger, this one is going to get really big. And the reason why is because we're passing through parts of space that make this likely. And they were able to tell that by looking at the stars, especially because they were experts in the equinoxes. And I think they knew that when you move through a part of the Milky Way galaxy, they noticed there was a change in the star density. Like if you've never taken a trip to Chichen Itza and go and look at the stars at night there, it's just fucking unbelievable. And to know what these people did and really, like, I did some of the deepest dives ever on Mayan time, especially since I'm a Bitcoiner. I'm huge into time. I don't think there's been a group of humans on the planet that understood time better than the Mayans. That's the truth. And when you actually look at the eukaryotic Lagrangian versus the bacterial one or the Archean one, archaea and bacteria are costly in energy. We're costly in time. And that's the reason why circadian biology is so important to us. When you understand that, the lessons that I've learned from the Maya, I think they're some of the greatest lessons that our species needs to understand. And remember what I told you all the way in the beginning. Our domain of life, meaning eukaryotes, have never faced a true magnetic flip ever. So I know what the reversion is. We go atavistically back. So that means we're going back through evolutionary time frame back to bacteria and archaea. That's the reason why the skulls of the Neanderthal, the skulls of the Paracas people, the skulls of the Egyptians, the skulls of the Peruvians, their bones, they have stories to tell. What did the Maya do? They put the stories in their buildings. They didn't put it in their bones because they didn't die. They put it, the only part of their bodies that they left a clue was the 5 meters thick of Mayan blue on the people they sacrificed in the sacred cenote. That's about the only skeletal remains that I can tell you is a big deal. I've never seen a Mayan skull either to have the elongated skull. So that tells me they did a great job. And, I happen to know where the Mayans wound up. They came back here to the volcanoes, to magnetically pin. That's what El Salvador is. They came back to a place called Cuslatan. And it's really a funny story because Cuslatan is really close to where my friend owns that volcano where I found the deuterium depleted water. It's right on the border of Guatemala. And the even more funny part of the story is when Bukele first got into politics, the first place he was a mayor It's called Nuevo Cuslatan. How do you like that? So, from that standpoint, there's a lot of harmony to the melody that I'm trying to paint for you. And even today in 2026, I'm building, a new retreat covered with paramagnetic, rare earth element rock all around me. I've already finished my house in El Salvador. This is the second house. The third house is being built in Atami. Same shit, dude. So that's how I'm magnetically pinning.
Dr. Kruse, I mean, I have to get running here. I cannot say thank you enough. This was, I don't think I've ever written down so many notes during something, and certainly when you checking this out again. If you want to just quick share for everybody, hey, where they can find all about you, please.
Any social media, it's always Dr. Jack Kruse. There's a lot of fakes, but it's always the same. No spaces. Kruse is Kruse. It's everywhere. I have a website, jackkruse.com. I got a form that's free. If you want all this biophysics that I talked about here, you want all the data that I just shared with Nick, go to my Patreon, www.patreon.com/Dr. Jack Kruse. You will find it all there in excruciating detail.
It's five
I
bucks a
will
month,
hurt
and
your
it's
brain.
totally worth it. Yeah, it's super simple, right?
It is, but it's fun.
It
And
is.
it's also cool learning about the history of us.
It's great. So, Dr. Kruse, thank you again so much. I greatly appreciate just your time, just everything that you've shared. Thank you.
All right, take care.
Bye. Thanks, guys.
Bye.